Today we will talk about electrocardiography, namely about the use of electrocardiography in children. Electrocardiography is a highly informative method for diagnosing diseases of the cardiovascular system. I want to draw your attention to the fact that a similar diagnostic study does not exist today. This means that there are a number of cardiovascular diseases and pathologies that are diagnosed only with the help of EKG. The essence of the method is to register electrical impulses that arise in cardiomyocytes during the work of the heart from the surface of the body. These electrical phenomena are recorded in the form of a graphic image called an electrocardiogram. The reliability of the electrocardiogram depends on the conditions in which it is recorded. What are the conditions? EKG rooms are specially equipped and isolated from additional sources of electric fields, that is, from X-ray diagnostic rooms and physiotherapy rooms. The couches on which the patients are located are at a distance of at least 1.5–2 meters from the power supply wires. Also, the ambient temperature should be at least 26–28 degrees Celsius in order to prevent muscle tremors, which can distort the EKG recording. We also get an access to legs, forearms, and upper body. Before performing an EKG, we suggest that the patient relax in a horizontal position, lying on his back with calm breathing. We also ask a patient not to talk or make any movements during the electrocardiography. We present the equipment that is used to perform electrocardiography. Electrocardiographs are single-channel and multi-channel. With the help of modern electrocardiographs, we can record an electrocardiogram in 12 leads, 3 standard, 3 reinforced, and 6 chest. Electrocardiographs are stationary and portable. Electrocardiographs consist of the apparatus itself, where we register graphic images of electrical impulses from the surface of the body. Electrodes are also presented. To record standard leads, we use clip electrodes, which are color-coded: red, yellow, green, and black. For children, clip electrodes are used somewhat smaller than for adults, but for teenagers we can use clip electrodes like for adults. To record the chest leads, we use suction cup electrodes, which are also color-coded: red, yellow, green, brown, black, and violet, or V1, V2, V3, V4, V5, and V6. For children, suction cup electrodes with a diameter of 15 mm are used. For older children, we can use electrodes with a diameter of 24 mm. Clip electrodes and suction cup electrodes are reusable electrodes. But in recent years, we have been using latex disposable electrodes. For children, electrodes of 32–36 mm are used. For older children and adolescents, we can use latex disposable electrodes with a diameter of 50 mm. For better electrical impulse conductivity, for reusable electrodes, we can take an EKG gel that is applied directly to the electrode. Or we can use a saline solution that is applied to the surface of the human body where the electrode will attach. There are also times when it is necessary to degrease the body surface in the area where the electrodes will be applied. This mainly happens when performing electrocardiography in adolescents. We use an alcohol solution and cotton balls. We begin recording the EKG with the application of the electrodes. Before applying the electrodes, we must make sure that the patient does not have a dextroposition of the heart, as in this case the order of applying the electrodes will be different. For better conductivity, we lubricate the skin areas where the electrodes will be located with saline solution. For recording the standard leads, we place the clip electrodes on the upper and lower extremities. On the upper limbs, we place electrodes in the lower third of the forearm, on the lower limbs in the lower third of the legs. We put the red electrode on the right hand on the inner surface. We put the yellow electrode on the left hand. We put the green electrode on the left leg. And we put the black electrode on the right leg. Next, we begin to position the suction cup electrodes to record the chest leads. We put the first V1 electrode in the fourth intercostal space on the right. We count the second rib, third rib, fourth rib. I want to draw your attention to the fact that the electrode is applied precisely on the intercostal space, since if it is placed over the bone tissue, the electrocardiogram will be distorted. We put the yellow V2 electrode in the fourth intercostal space to the left of the sternum. We put the V4 electrode in the fifth intercostal space on the left along the midclavicular line. And we put the V3 electrode in the gap between V2 and V4 electrodes. We put V5 electrode on the anterior axillary line in the fifth intercostal space on the left. We apply V6 electrode in the fifth intercostal space along the middle axillary line. After applying the electrodes, we must once again make sure that they are located correctly. We begin the registration of electrocardiogram. To do this, we must set the speed and also enable filters. On this register, all this is already done automatically. Therefore, we can check the calibration of the apparatus. For this, at the beginning of the tape, we can see the control millivolt, which will be 10 mm high. We start recording. We got a 12-lead electrocardiogram. I would like to draw your attention to the fact that on each electrocardiogram we indicate the patient's passport data: last name, first name, and age. Further, the electrocardiogram is transmitted for evaluation to a functional diagnostic doctor or cardiologist. After the conclusion of the specialist, the electrocardiogram is transferred to the patient's hands and stored in the outpatient card in order to be able to evaluate the previous electrocardiograms and subsequent ones, since it is important to evaluate the EKG in dynamics.